Endoscopic Management of Gastrointestinal Motility Disorders, Part 2, ESGE Guideline. Source and Scope. This guideline is an official statement of the European Society of Gastrointestinal Endoscopy. It provides guidance on the endoscopic management of Zenker's diverticulum, gastroesophageal reflux disease, intractable constipation, and Ogilvy's syndrome. The Grading of Recommendations, Assessment, Development, and Evaluation (GRADE) system was adopted to define the strength of recommendations and the quality of evidence. Introduction. Therapeutic gastrointestinal (GI) endoscopy is rapidly evolving. Its role in the management of motility disorders of the digestive tract is increasing. The purpose of this guideline is to provide guidance on various aspects of the endoscopic management of GI motility disorders. This is the second of two parts of the guideline and is dedicated to Zenker's diverticulum, gastroesophageal reflux disease (GERD), intractable constipation, and Ogilvy's syndrome. The first part, published as a separate manuscript, focused on achalasia and gastroparesis. Main recommendations. ESGE suggests flexible endoscopic treatment over open surgical treatment as first-line therapy for patients with a symptomatic Zenker's diverticulum of any size. Weak recommendation, low quality of evidence, level of agreement 100%. ESGE recommends that emerging treatments for Zenker's diverticulum, such as Zenker's peroral endoscopic myotomy, Z-POEM, and tunneling, be considered as experimental. These treatments should be offered in a research setting only. Strong recommendation, low quality of evidence, level of agreement 100%. ESGE recommends against the widespread clinical use of transoral incisionless fundoplication, TIF, as an alternative to proton pump inhibitor, PPI, therapy, or anti-reflux surgery in the treatment of gastroesophageal reflux disease, GERD, because of the lack of data on the long-term outcomes, the inferiority of TIF to fundoplication, and its modest efficacy in only highly selected patients. TIF may have a role for patients with mild GERD who are not willing to take PPIs or undergo anti-reflux surgery. Strong recommendation, moderate quality of evidence, level of agreement 92.8%. ESGE recommends against the use of the Medigus ultrasonic surgical endostapler, MUSE, in clinical practice because of insufficient data showing its effectiveness and safety in patients with GERD. MUSE should be used in clinical trials only. Strong recommendation, low quality evidence, level of agreement 100%. ESGE recommends against the use of anti-reflux mucosectomy, ARMS, in routine clinical practice in the treatment of GERD because of the lack of data and its potential complications. Strong recommendation, low quality evidence, level of agreement 100%. ESGE recommends endoscopic cecostomy only after conservative management with medical therapies or retrograde lavage has failed. Strong recommendation, low quality evidence, level of agreement 93.3%. ESGE recommends fixing the cecum to the abdominal wall at 3 points, using T-anchors, a double needle suturing device, or laparoscopic fixation, to prevent leaks and infectious adverse events, whatever percutaneous endoscopic cecostomy method is used. Strong recommendation, very low quality evidence, level of agreement 86.7%. ESGE recommends considering endoscopic decompression of the colon in patients with Ogilvy's syndrome that is not improving with conservative treatment. Strong recommendation, low quality evidence, level of agreement 93.8%. ESGE recommends prompt endoscopic decompression if the cecal diameter is greater than 12 centimeters and if the Ogilvy's syndrome exists for a duration of longer than 4 to 6 days. Strong recommendation, low quality evidence, level of agreement 87.5%.